Hello, today I'm going to be discussing Braxton Hicks contractions. It's important to know about these and how they differ from normal signs and symptoms that indicate that you may be going into labour. One of the symptoms you may experience towards the end of your pregnancy are Braxton Hicks contractions. They are also known as false, practice contractions, or surges, as they are not like true contractions that happen in active labour. Braxton Hicks contractions are a sign that your body may be preparing to go into labour, and people usually experience them before true contractions, although not everyone experiences Braxton Hicks contractions. They can begin as early as 20 weeks of pregnancy. However, they're most commonly experienced in the third trimester after 20 weeks gestation. They can be painless and you may not even realize they are happening, but they can increase in intensity as pregnancy progresses. A Braxton Hicks contraction or surge is when the muscles of the uterus tighten for approximately 30 to 60 seconds and might last as long as 2 minutes, but they are usually irregular and brief. When labour first starts, known as the latent phase of labour, early contractions can be mistaken for Braxton Hicks contractions, as both appear sporadically. However, unlike labour contractions, Braxton Hicks contractions do not become stronger and longer over a period of time. Active labour contractions or surges progress in frequency, becoming more regular, lasting longer, and becoming stronger. They feel like waves that build up to peak intensity and then gradually decrease. Therefore, the key to recognizing labouring contractions is noticing a pattern of increasing length and intensity in your contractions. Braxton Hicks contractions don't dilate your cervix, but they do help circulate blood to the placenta. You will usually only feel them towards the front of your tummy, and they usually go away with a change of position or activity. To help ease Braxton Hicks contractions, you can empty your bladder, because a full bladder can cause contractions. Change your activity, so for example, if you've been moving around a lot, maybe try resting, and if you're lying down, lie on your left side. You can go for a walk, keep hydrated, or take a bath. These contractions are not necessarily a sign that labour is starting, but if you are concerned about the pain or how often they are coming, please call your maternity team, especially if you are under 37 weeks pregnant. One important thing to remember as you're coming towards the end of your pregnancy and noticing signs and symptoms of labour is to think about your baby's movement. You may hear people say that it's normal for babies to move less towards the end of your pregnancy, but this is false as babies continue to move in labour and birth. Your midwife will discuss your baby's movements at your antenatal appointments. You may have recognised a pattern in your baby's movements, and it is important to notice what is normal for your baby. If you notice your baby is not moving as they usually would, make sure to contact your maternity team or midwife immediately to make sure you get it checked out.